drug information and education course. In this video, we will learn about the 5 steps needed in patient counseling session. The first step is an introduction, followed by gathering patient information and identifying potential problems. The next step is developing care plan and resolve the problems, followed by providing information and education. And the final step is closing the session. Alright, how all these steps are applied? Please watch this video till the end.
Welcome to Sehat Pharmacy. I'm Abby, the pharmacist today. How may I help you?
Yes, I'd like to have a prescription filled.
Certainly. May I have your name?
I'm Mrs. Anton.
Sure, Mrs. Anton. May I see the prescription, please?
Yes, here you are.
Thank you. Alright, the prescription is dated November 3 today from Dr. Evie to Mr. Anton. So this prescription is for your husband, right?
Yes, that is for my husband. We just went to the hospital. My husband has sore eyes, so I asked him to wear sunglasses.
Sure, ma'am. I learned that the medicine prescribed for your husband is categorized as a prescription-only medicines, which of course need a more comprehensive explanation to make sure that Mr. Anton or you could help take the medicines better, of course to get a maximum benefit. Would you mind to spend your time about 10 minutes for the counseling?
Are you good with that?
Of course, that's better than being confused about medicines.
Sure, we can do that.
Great. To make us more comfortable, would you mind to move to the next room so that we can have seat?
That's a good idea. Let's go.
Sure. Please after me, Mr. and Mrs. Anton. Please have a seat.
Thank you.
So, Mr. and Mrs. Anton, during this counseling, please allow me to take some notes of several things related to Mr. Anton's health. But please do not worry, as we will maintain the confidentiality of the information. Would you give consent for that?
Yes, we give consent for that.
Thank you. And please, if you have any question during this session, please do not hesitate to ask me anything.
Sure.
Okay, may I have your husband's complete name?
Anton Dwi Susilo.
Anton Dwi Susilo. How old is your husband now?
55 years old.
Okay. How about the weight?
60 kilograms. He has lost a bit of weight lately.
Yes, I bike quite often lately.
Great. Regular exercise is so good for you, sir. Please keep it up. May I have your current address?
Madura Street, number 10, Yogyakarta.
Alright, thank you, ma'am. When you met the doctor earlier, has the doctor told you or explained to you about the medication for Mr. Anton?
What did the doctor say earlier?
Actually, not much, but he mentioned that I will be given about oral medicine and ointments.
Alright, no problem. Has the doctor told you or explained to you about how you should take the medicine?
Not yet.
Not yet, okay, sure, no problem. Has the doctor told you about the intended use of each medicine?
Not yet either.
Okay, please do not worry, I'll explain to you later everything.
Okay.
If you don't mind, sir, can you please tell me about the symptom?
So his left eye is wet and watery. It feels painful, sore, itchy, and eye discharge comes out all the time, and he gets swelling. And he said he's getting a reduced vision.
Okay. Do you possibly know, ma'am, what things or maybe activities your husband did that might trigger the symptoms?
Well, I'm not quite sure, so I asked him, but he was not sure as well. So maybe he contracted it when he was biking with many other people, but I'm still not sure.
Okay, so only the left eye, right? Has your husband had this before?
No, it's the first.
Okay, and sure, before seeing the doctor, has your husband taken any medicine to cure the symptoms?
Actually, I use Insto eye drop because my eyes got red and it's really hurt, but it didn't heal at all. So I went to the doctor yesterday and they give me this precaution.
Okay, do you have a medical history of other diseases, sir?
Yes, I have hypertension.
Are you taking any medicines for your hypertension?
I take amlodipine for my for my community health center, and I take it once a day.
So amlodipine. Okay. Is she taking any other medicine, ma'am?
I don't think so, but sometimes he takes vitamins.
Sure. Does he has any allergies?
No.
How about gastric disorder?
No.
Okay. And I apologize, sir. Are you smoke or drink alcohol?
No, I don't.
Okay, I'm sorry. I need to ask this because some of the medicine has certain interaction with alcohol. Okay, so from the information you gave me, there is no issue with your medication and you can still take your hypertension medication as usual and it will not influence the medication you'll take for your eyes.
Alright, so it is safe for me to continue my activity?
Yes, please. Okay, I'll collect the medicine first. Please wait a moment.
Thank you.
Thank you so much, Mr. and Mrs. Anton, for waiting patiently. Here are the medicines. There are 3 of them. I'll explain to you one by one slowly. The first one is acyclovir tablets, 400 milligrams. This is an antiviral to overcome the herpes virus that contracted your eyes. To use this medicine, please take it 5 times a day, 2 tablets each time. Allow me to repeat once again, 5 times a day, 2 tablets each time. You can take this medicine after meal, and please leave about 4 hours apart from each dose beside your sleep time. What time do you usually go to bed and wake up, sir?
I wake up at 4 a.m. and I go to bed at 9 or 9:30 p.m.
Great, Mr. Anton. So you may start taking your medicine at 5 a.m., 9 a.m., 1 p.m., 5 p.m., and the last dose is 9 p.m. One important thing you should remember, sir, is you need to finish all course of this medicine. So even though maybe in 2 days or 3 days you feel that your symptoms have improved, you still need to finish them because we want to make sure that the virus really disappears. The doctor has prescribed you as many as 70 tablets, so all of them should be taken for 7 days. Is there any questions so far, Mr. and Mrs. Anton?
Yes, so this medicine should be taken 5 times a day, 2 tablets each time, right?
Correct.
It's quite a lot, isn't it? Because usually we take medicines only 3 times a day.
Yeah, it's quite a lot, and many patients ask me about this. But ma'am, each medicine has its own characteristics, and for acyclovir tablets, it works effectively with specific dose 5 times a day, 2 tablets each time for 7 days. So if your husband takes less than that, it might not effective and the eye sore might not heal.
I see. Then does it have to be taken with a meal?
Great question. No, it doesn't have to take with meal. You can take this without food or while having food. So it's still safe if your husband take it without food or while having food. And ma'am, just make sure that your husband will finish all the medication.
Okay.
Let me continue with the second one. This is Cendo Herpes. Let me open it for you. Cendo Herpes. It has the same content as acyclovir but in the form of an ointment. To use this medicine, please take it 3 times a day through a thin smear on the left eye. Please take it 7 days, as same as acyclovir tablets. Before this, have you ever used any eye ointment, sir?
No, I never use it, but I just use eye drop because I'm afraid of it. Is it safe for me to apply this ointment to my eyes?
Yeah, it is safe as this is specifically designed for the eyes, so it's different from the one used for the skin. Okay, to use this medicine, please first don't forget to wash your hand and then sit upright. After that, lay on the chair, and you may face a mirror to help you put the medicine in the right place. But of course, your wife can also help you with that. After you are sitting upright, tilt your head slightly up, and then pull the bottom of your eyes with your left eye so that it will concave up like this. Yeah, sure, like that. And then close your eyes for a while to make sure that the medicine will fully enter your eyes. But don't worry, if some of the medicines comes out, just wipe it or clean it with tissue. And sir, please avoid blinking, as blinking will make the tears comes up. Of course, we don't want the tears wash away the medicines very quickly, right? And then avoid touching the tip of the package because we want to keep it sterile, so don't touch it with your hand or even your eyes. Okay, after using this, just close it immediately and you can wash your hand after that. Is that clear enough to understand?
So we have to apply the ointment about 1 centimeter in the inner lower eyelid, right?
Yes, exactly.
Okay.
Okay, let me continue with the last one. This is diclofenac sodium 50 milligrams. The doctor has prescribed you as many as 10 tablets. It is used to treat pain and also reduce swelling in your husband's eyes. Please take this 2 times a day after a meal. Please note this, ma'am and sir, after a meal. And of course, if you don't feel any pain anymore, you can just stop using this.
Sure, this is taken 2 times a day, 1 tablet each time.
Yes, correct.
Do this medicine actually have any side effects?
Yes, sir. There are some side effects of using these medicines. First, acyclovir 1. It may cause digestive disorders, and some of patients complain about sweating at night. And diclofenac 1, it may irritate your digestive tracts also. It causes stomach ache, and some of patients complain about nausea, vomiting even, and also heartburn. But don't worry, because you don't have a medical history of gastric problems, so the risk is relatively small, sir. And in addition, this one, change hair phase, it may cause a blurry in your vision, but don't worry because after a few minutes it will be back to normal. But sir and ma'am, side effects don't happen to everyone. So if your husband experience any and is unbearable, you can return to the pharmacy or just go back to the hospital to consult with your doctor.
Alright, buddy. So it is safe and won't make me crazy, right?
Yes. Okay, so this medicine still have an extended expiration date. For gender herpes, for example, it is used for 7 days, right? But still have an expiration date for 30 days after you open the package.
Sure.
And for storage, you can store these medicines in a dry place, away from sunlight, children, and moisture. And please don't keep it in the refrigerator, okay?
Okay.
And sir, I suggest you not to travel or bike first to avoid the dust that can worsen your eyes.
Yeah, I stopped biking for a while since my eye got hit actually.
Great, and after it heals, you can start biking again. And I suggest you, sir, not to touch your eyes with your hand because we're afraid the bacteria and viruses in your hand would worsen your eyes.
But he likes to rub his eye because he said it's itchy and eye discharge keeps coming. What should we do?
You can use a tissue for that.
Okay, finally, because I can really stand it when you see that really gets itchy in my head actually.
Yeah, I know that. I also suggest not to share the medication with other people because the symptoms might appear the same, but the medicines can be totally so different. To avoid missing the information, can you please repeat the direction to use these medicines?
I'll do it. I'll remind him later. So the first one is aciclovir. It's taken 5 times a day, 2 tablets each time, every 4 hours after meals. And then the second one is diclofenac sodium. It's taken 2 times a day, 1 tablet each time, only taken when the eye feels hurt or still swollen. And then the last one is the eye ointment. It's used 3 times a day, but before we need to wash hands first and then look up and then pull up the lower eyelid to form a concave up, then apply it in the hollow of the eye for about 1 centimeter and then wash hands again.
Great, that's correct. Please remind your husband to finish all course of the aciclovir. Is there anything else you may to ask?
No, it's all clear.
Great. May I have your phone number to be included in our patient visits data?
Sure, here's my number 085
Okay.
566 77 8899.
Okay, great. And this is the leaflet on how to use the eye ointment. You can read it later.
Okay, thank you.
Okay, and also, sir, please stop using the Insta eye drop.
Alright.
Okay. This is my business card. If you have any question or if you need any help, you can just text me or call me. Okay?
Yes.
Thank you so much for visiting our pharmacy, Mr. and Mrs. Anton. I hope you get well really soon and get back to region quickly.
Thank you very much.
Yes.
Mr. Anton, Mr. Anton and Mrs. Anton, this is your medicine.
Okay.
Thank you.
So that's all the 5 steps for the counseling session. Hope you can learn from it. Thank you for watching this video.